Thank you for taking 5 minutes to watch this film. I'd like to tell you a little bit more about the reasons why you've been referred to St Vincent's Caritas Christi Q and extend a welcome to you and your family. Hopefully through the time that you're with us, you'll really get to understand what we have to offer, and we'll be maintaining contact with your existing GP and healthcare providers. So welcome. I hope you and your family feel well cared for. Your healthcare team may have already begun a discussion with you about coming to one of St Vincent's healthcare facilities. Caritas Christi Q represents an environment where people can feel safe and well cared for.
Caritas Christi Hospice was established in 1938 by the Sisters of Charity. Originally there were 4 sisters that came to this site, raised money and were able to build the hospice as we know it today.
You know, people have a lot of their own ideas about what palliative care is. It doesn't mean that death is imminent by coming to Caritas Q. It's not where you come to die, it's where you come to live while whatever else is going on for you. It's not a nursing home. We don't do long-term care. It's not a place where we do active treatment.
Even though we are a standalone facility here, we are certainly very connected to our tertiary hospital, St Vincent's in Fitzroy, also to our private hospitals, but we are very connected to the other major hospitals in Melbourne, private and public.
Well, I often talk about it as being a bit like halfway between home and hospital. So it's got all the benefits of hospital in terms of having 24-hour nursing care, access to a doctor 24 hours a day, that sort of thing, but has a bit more of a relaxed feel.
So I work at both Kew and Fitzroy. Being a part of both facilities, they both have their merits. Both provide outstanding service. In Fitzroy, I suppose it's part of the hospital, so it's a little bit more hustle and bustle there. Here at Kew, we have a bit more of a homely environment.
People can come and go as they want, so I think that freedom allows people to feel at home here. If they want to sleep over or have lunch dates or come in and out, then we can make that happen in the way that they need.
People can bring their pets in, people can find a location to have a smoke or two. And we do have a lot of ability to be a little bit more flexible than what you'd expect in a healthcare service.
I think the gardens are one of the biggest draw card for this place. Just to have access from almost every room into a courtyard or out the back to the garden.
We're actually next to quite a bit of bushland that can give you a feel of being in the bush.
And there's lots of communal areas that people can come into and use.
So this is our multi-purpose room or art room. So we can organise painting, drawing or ceramic work. Part of our family dining room, so people can partake, have a bit of time out, sharing a meal together. And we have volunteer musicians, so once a month this space usually turns into a concert space as well.
We've got a lot of volunteers who make the place feel homely. There's lots of home cooking and baking. There's Lynn who comes every Thursday and makes cakes for everyone and they'll take them around to the patients. There's Beverly on a Wednesday who'll come with a drinks trolley, and Henry the dog around to visit patients.
It does appear that we might be a bit more isolated than being in the city, but the public transport is still quite good.
We are very close to Kew Junction, so some people may choose to get here by a tram. We have the 200 bus and the 207 bus that comes right out the front, and also people can come by car. We have free parking out the front and street parking as well. So it's about 3 kilometres away from Fitzroy, so we're very closely located.
I think they expect to have good medical care and good nursing care, and they definitely do get that here. I don't think they expect to get as much kindness and as much care as they do receive. The staff here are absolutely amazing. They just go above and beyond. That warmth that I experience even as a staff member, it's a privilege to be able to work in this environment.
So certainly coming to have a look would be something that, if that's possible, I would encourage all families to do, and if it's appropriate for the patient as well.
If you're interested in coming to Caritas Christi at Kew, the best way to contact us is to ask your nurse or your treating doctor to contact the Palliative Care Consult Service.